Well, the site is available. Obviously, we've seen stories about it already as well, but the launch is still scheduled for tomorrow, kind of mid-morning. This is kind of normal routine practice to make sure the site is functioning and executing well. And so, the site, it is accessible for folks, but we haven't officially launched it yet. But I know, hundreds of thousands of folks are ordering tests right now. So I guess you can't hold back that level of interest and demand, and we're glad. We know that we're meeting a need, and so excited to get it out. But again, haven't changed the date. This is just part of the routine process. That the website is live because we have to see how the website performs. We've been ramping up volume on it, in a stepwise fashion to make sure that it's able to absorb that load, and it is, and the site seems to be functioning well. But I think that our plan is always to launch it tomorrow morning, and understanding that the website being open, being available, was so that we could scale up that load, make sure the site's absorbing it without any problems, nothing for us to troubleshoot in the meantime. So I think that the main difference here is that if we encounter any challenges, any glitches along the way today, we're able to fix them, and that's in advance of when the launch was scheduled for tomorrow. So of course, it's not us telling folks that this site is out there, but internet sleuths are skillful, so they found their way to the site a little early. Mid-morning was our plan. You won't be able to miss it. We'll make sure that we get the news out there far and wide. But again, I think, like I mentioned, there are lots of folks already ordering. I think people don't have to necessarily wait. I think it's just the expectations from the site are different. Oftentimes in the kind of beta testing phase, the system will automatically kind of intermittently block some number of users just to see kind of how the website performs and how it manages the load. So again, it's experientially may be different for them, but if you're able to get through the site and order today, it's just as if you're ordering the site, at any point tomorrow after it's launched live. Any orders that are going in today are officially, into the queue and part of the pre-order process. So it's not that folks have to necessarily wait. Well, so the program is designed for one test kit per residence, and so test kit includes 4 tests, and so that's 4 tests per residential address. And USPS, of course, maintains the list of residential addresses. We're trying to get it out to as many residences as possible. There are over 120 million here in the country, and with 4 tests per kit and 500 million tests that we have, that's 125 million. And so we have a test kit for everybody, by that standard, everybody who's in a residence. And we also have additional programs. This isn't our only way to get tests out to community. We have 50 million tests going to community health centers. We've got tests going to long-term care facilities. We have tests going to organizations that serve people experiencing homelessness. So lots of different ways that we're getting free tests out into communities, in addition to the insurance program that just launched over the weekend. So the president's really called out the stops, really doing everything that we can to try to get tests to people. Yeah, it's not a trust system. After a residence has ordered a test kit, it's not physically able to order another one.
Okay.
It's locked out of the system. So no, it's
Okay.
not it's not an honor system, or else we would expect that people would order more than their share. But I think the idea is, if at some point, the supply outstrips demand, and there's no more interest in the test, which I'd be surprised. As a nation, we used over 300 million tests last month alone. But if we do see that demand wane, then it's entirely possible that we'll allow people to order a second test kit and would make that announcement. But in the meantime, really trying to focus on making sure that every household gets at least one kit. Well, the contracts that we executed for these 500 million tests, one of the explicit requirements is that it's above and beyond the tests that are on the market. So this isn't taking away from what these manufacturers are putting in your CVS, your Walgreens, your Rite Aid. It's not taking away from what they contracted with states or with localities. This is specifically an above and beyond amount. And so we're calling on the manufacturers to really ramp up their manufacturing enough to meet this need. Those who signed the contracts said they're able to do that, and they're able to maintain their obligations to states, to localities, and to the market as well. One thing that we've mentioned is we're going to have 375 million test kits available in the market this month as well, in the month of January. And then you also have the 500 million on top of that. So
Right.
really, you compare that to where we were just a few months back. In November, it was 100 million tests that were on the market. And between this program and what we have on the market, we're talking about many times that amount this month. That's the kind of demand that we're seeing. We know we have to meet this moment, and that's why we're taking really strong actions like this. We expect people to be able to get into the website. We've done a tremendous amount of work on the front end to make sure that the user experience is good. And again, nothing is perfect 100% of the time. But as far as what the industry standard, what the industry knows to do to open any kind of website with the kind of volume that we're expecting, I think we've taken those precautions and we've got quite a few precautions in place. And so we're looking forward to a strong launch and a website that's fully functional and able to support the amount of volume that it sees. And of course, if the volume is so great that it crashes the site, that would be surprising to us based on all the work we've done on the front end, based on all the modeling we've done in terms of
Mhm.
our expected demand. But we expect that we're going to be able to not only absorb that volume, but if something goes wrong, we've got some really good contingencies in place to keep the availability for people to order. Well, this is the same U.S. Postal Service has just pulled off Christmas. So I think that what we know is that they're able to do it. They're able to deliver a tremendous amount of volume, and they kept their same staffing from the Christmas season. So instead of scaling that up and then scaling it back down, they're keeping people available to help support this. And so USPS is really a first in class operation in terms of delivery, and we think they're equal to the task. So no, we're not concerned about delays because they're not concerned about delays. Absolutely. That's the notion behind this program. It's not a program that's designed for you to order a test when you feel like you had an exposure or you feel sick. If that's the case, then you should go get tested within your community or pick up an over-the-counter test at your local pharmacy. Here, this is a program so that you can order tests today, have them there within the next next week or two, and in that time, anytime thereafter, if you're to develop symptoms, you don't even have to go to your local pharmacy or to a community health center. You can just go to your cabinet or to your bathroom and pull out
Right.
your test kit, right? So that's the idea. It's to make sure that people have this before they ever have any challenges. And we think that if we prime that pump, if we get tests into people's homes, it's really going to be a huge benefit in our effort to fight this pandemic.